let's start with this prescription drug thing, because this is huge. Like, this one's actually really big. Just as a way of history, for those who haven't been following this, Trump in his first term tried to take this on. The fact that Big Pharma won't negotiate with our government won't negotiate with Big Pharma to protect us on the prices that we have to pay. Trump tried to do it and got sued. He tried to do it just with respect to Medicare. He got sued by Big Pharma and he lost, because technically it's Congress's job to negotiate these prices. And so it's a question of constitutional authority. So Big Pharma sued, saying you don't have the authority as president to do an end around Congress. And they won because of separations of powers. Big Pharma doesn't give a shit about separation of powers. Big Pharma wants to charge us a lot of money. But they used the Constitution to shut down Trump's effort in term one. Then comes Joe Biden. Okay, so now there was an attempt, and this one was successful, to make us negotiate on, I think it was first 8, and then it was 10 drugs for Medicare only. So the government could negotiate with Big Pharma on these now 10 drugs. That's it out of the universe of drugs. It's not a lot, and it's only under Medicare. And now Trump comes in. And by the way, this has always been more of like a Democrat thing, and Republicans have more, well, I mean, they've both been in the pocket of Big Pharma, to be honest. Both sides are totally in the damn pocket of Big Pharma. And we don't hate Big Pharma. Big Pharma comes up with drugs that can help us, not die. And they come up with miracle drugs like Ozempic, which is helping a lot of very, very obese people get down to much more healthy weights. So it's not to demonize Big Pharma, but they're also disgusting. They're disgusting in so many ways. They're absolute pigs when it comes to exploiting, especially the American consumer. And Anna Kasparian, who's with the Young Turks, she's a Democrat. She's a liberal. She's great. She's very reasonable. She's been on this program a number of times. And this has been one of her main issues. She's the one who first got my attention on it, trying to say, what the F? Why aren't we doing this? Why aren't we, as a government, more protective of our own people? And why are we allowing Big Pharma to charge Americans $1,000 a month for some drugs that the same manufacturers charge people in Denmark $50 a month for? So the same drug, you could be paying $50 for it if you live in Denmark, and you could pay $1,000 for it if you live in the United States. And do we have Anna cut? She was going off on this. Okay. In any event, she was showing the bullet points in particular on Ozempic. And I realized that's a very popular drug, but you could do this with a lot of other drugs where you go around the world, and we, the suckers in America, are subsidizing the world's cheap use of these drugs. And it's bullshit. She played a soundbite of Bernie Sanders. And as you know, Bernie and Trump kind of are at the horseshoe ends of the same ideological spectrum. Trump got there from the right, Bernie got there from the left, and they wound up kind of close to each other on a number of issues. And the crossover amongst fans is kind of interesting with those two. She played this Bernie soundbite where he was asked, because he's been pushing for the ability for us to negotiate on drug costs for a while, where he was asked by an MSNBC anchor about it. Watch.
Why does Novo Nordisk, in your opinion, charge so much more for Americans to get this drug?
I know exactly why, and so does everybody else. Throughout the entire world, there are national health programs, which, by the way, in most cases guarantee health care to all of their people. And they sit down and they negotiate with the drug companies. And they say, you know what, you can't charge us any price you want. Let's sit down and talk about a reasonable price. Here in the United States, until last year, you had the insane situation where the drug companies could charge any price they wanted for any reason. Second of all, let's not kid ourselves. The pharmaceutical industry is enormously powerful. They have over 1,800 well-paid lobbyists in Washington, D.C. right now, former leaders of the Republican Party, the Democratic Party. They're very nonpartisan. They will give money to anybody.
Okay, and here's just to put some more meat on those bones, Walter. She was showing a map that she that was from the MSNBC segment with Bernie on this, just for the example, Ozempic. That costs about $1,000 per month in the United States before insurance. In Canada, it goes for $147, $59 in Germany, $96 in Sweden, $103 in the Netherlands, $144 in Switzerland, $83 in France. Why do the Americans have to pay $1,000 for the exact same drug that she points out can be manufactured for less than $5 a month per a study performed by Yale and King's College Hospital in London? This is what Trump is trying to get at with this extraordinary executive order. He now says on all drugs, not just Medicare, we're going to start negotiating. We're not going to be the world's piggy bank where they make all their money in the United States and then sell it cheaply to everybody else. And that he says this could save people up to 80% on their drug costs. Number one, there's likely to be another lawsuit by Big Pharma saying this is an inappropriate end around Congress. And number two, it'll be really interesting to see how the Democrats react to Donald Trump pushing this kind of Bernie-blessed program when it comes to pharmaceuticals. There you go. You take it, Walter.
Is this a country of politics or a country of issues? Because in this case, Bernie and Trump agree. And Bernie has been loud on this matter for a long time. He should get his butt over to the White House and show some solidarity on this, because they're going to need it against the greatest lobby in American life, next to the, I suppose, military-industrial complex. The fact is that drugs like Ozempic, and this one in particular, are not that complex. It's a peptide called semaglutide. It can be bought cheaply as the peptide itself. In its patented drug form, it's made more expensive. But the excuse that the U.S. has to pay higher prices, vastly higher prices, in order to subsidize the research and development of these drugs so that the rest of the world can benefit from lower prices, is ridiculous. But it has been the fig leaf, the massive fig leaf that they have used to cover their profiteering for decades. Really, under Obamacare, there was a real conspicuous omission because the supposed aim of the bill, of the legislation, was to lower prices for American healthcare. But it did not include negotiation with drug companies for lower prices. Everybody noticed that at the time, that carve out, as it were. And now Trump's ending it. And frankly, this is a demolition job on mere partisanship, because just as you quoted the Young Turks person, if we can't get together on this, then we can't get together on anything.
Mm-hmm. Yes. So it's what's been happening in Congress is they're bought and paid for. I mean, that's really the bottom line. Big Pharma, as the audience knows and experienced firsthand during COVID with Pfizer, it owns the U.S. Congress. They make tons of money, and then they buy congressmen and women so that they won't do anything to change the piggy bank system. And they don't. Neither side is innocent.
Megyn, you and I both attended the RFK Jr. Confirmation hearings, I happen to know. I was only one row away from you. And I think we saw there both Bernie and Elizabeth Warren hectoring the man who wanted to pressure Big Pharma and challenge them on all sorts of fronts, from the effectiveness of their drugs to testing drugs like the vaccines and so on, and prices. And they were acting like they were lawyers for Pfizer. Well, everybody's a lawyer for Pfizer if they're getting paid by them. And I'm afraid Bernie, he makes it a little complicated. He gets a lot of money from them. He gets it from their employees, and he claims that he gets it, one little bit at a time, and it doesn't represent management contributing to his cause. But it's a massive set of donations to him and to the Democrats. And he can prove his independence, if he'd like, by coming together with Trump. And if they think there are some problems with this executive order or the particular way that it's going to happen, that's fine. But the principle has been agreed on, as you say, by the horseshoe for a while. So it's time to do something for the American people. we must transcend TDS in certain cases. I wish we did in most cases or all. But if we can't do it here, I don't know where we're going to start.
Yeah. So Bernie is there, he's in Congress. Obviously, he's a sitting U.S. senator, but good luck convincing your fellow congressmen to actually do this once and for all. And that's the reason why Trump tried to do an end around the Do Nothing Congress, because he isn't bought and paid for by Big Pharma, but failed because the court said, sorry, sir, this is not within your remit. But today, Trump spoke to that. At the end, he had a presser at 9:30 talking about this and the Chinese deal. And it was at this presser that he signed the executive order, and he had his health team with him, Jay Bhattacharya of NIH, Robert F. Kennedy Jr. of HHS, Mehmet Oz of Medicare. Obviously, he's going to be involved in this too. And I think Marty McCary was there of FDA. So Trump got up there and said, basically, I dare you now, Democrats in Congress, to defy me on this. So Trump seems pretty clear. I'm sure he's been told, you tried this in Trump 1.0 and you got sued successfully, as you don't have this executive power. Because once again, he's using executive power, which is probably going to get stopped by a court just as soon as Big Pharma files a lawsuit. But Trump's already baking that in, saying, I dare the Democrats in Congress to not pass this in the big, beautiful bill that they're working on right now, the big money bill that's going to raise taxes or lower taxes or whatever. They're working it out. Because he said, how are you going to look at your constituents and say, you finally had the chance in legislation that would have Republican support in the Congress and the support of the sitting president ready to sign it, to finally give the government this power to negotiate on the drug prices, and you refused to do it, which is very clever to put this in the big, beautiful bill and frame it that way.
Well, it's not only clever, it's absolutely essential in a time of budget cutting, particularly, to do something like this, because the biggest client, the biggest patient in the United States, so to speak, is the United States government. It's the taxpayer who pays for these drugs in so many cases, through all kinds of programs. And it's going to save us collectively a lot of money, and individually, untold amount of money in family budgets. I just think that it was time that Trump really held their feet to the fire on the social issues and the populist programs that they claim to support. And I think it's a masterstroke. I did a little reporting on it last night. They've kept it very close. We were all taken by surprise. I'm shocked that it didn't leak. And Pharma's counterattack is going to be interesting because it will be somewhat deceptive. Already they're trying to argue that somehow this is a blow against the third world, which will no longer, have the benefit of our subsidized drug research. And I've even seen people say, well, they're trying to solve immigration by killing all the people that would immigrate here by, it's going to be hysterical like you haven't seen.
This July, there's a global summit of BRICS nations in Rio de Janeiro. The bloc of emerging superpowers, or so they hope to be, including China, Russia, India, and Iran, are meeting with the goal of displacing the U.S. dollar as the global currency. They're calling it the Rio Reset. As BRICS nations push forward with their plans, some worry global demand for U.S. dollars could decrease, bringing down the value of those dollars that are in your savings. While this transition, if it happens, will not happen overnight, the Rio Reset could mark a pivotal moment. So learn if diversifying your savings into gold is right for you. Birch Gold Group can help you move your hard-earned savings into a tax-sheltered IRA in precious metals. Claim your free info kit on gold by texting MK to 989898. With an A+ rating from the Better Business Bureau and tens of thousands of happy customers, let Birch Gold arm you with a free, no-obligation info kit on owning gold before July and the Rio Reset. Text MK to 989898 today. Thanks so much for watching. If you like what you just saw, hit the subscribe button for more clips and full episodes.